Dear learners, welcome back to NPTEL online certification course on novel drug delivery systems. I am Dr. Satish Devanapelli, working as assistant professor at Department of Pharmaceutical Sciences and Technology, Institute of Chemical Technology, Mumbai. In our targeted drug delivery systems, we are discussing on various types of strategies, of formulations, and in our previous lectures we have discussed what are the targeted drug delivery systems, and then we have discussed various fundamentals and also basics of target drug delivery systems. In our previous lecture we have seen the stimuli responsive targeted drug delivery systems, and in that we have also discussed what are the multifunctional targeted drug delivery systems, and then we have seen one case study of the pH sensitive target drug delivery systems. So, with this today we are going to see few more delivery systems which are specifically we are going to see on the tumor targeted drug delivery systems. So, these are my contents for today's presentation. So, first of all I will discuss what are the features of the tumor microenvironment, so which is very important for the targeting. Then we will see few basics of the targetings. In that we are going to see what are the levels of tumor targeting, and then we are going to see what are the ligands we can use it for the tumor targeting. Then few points we will see on biopharmaceutical characteristics of the delivery systems for the tumor specific delivery, and at the end we are going to stop today's lecture with the case study. So, here the first of all, as we are discussing from in many days on the tumor microenvironment. So, yes, before targeting we should know the pathophysiology of the disease is the most important for the targeting. So, here as we know the cancer cells will undergo the abnormal growth, as definition suggests that cancer cells are the abnormal growth in the cells. So, uncontrolled proliferation of the cells, whereas in case of normal cells and their features and their structure and the function characteristics are completely different, and here the function of the cancer cells is completely different from the normal cells. So, to grow, to multiply or uncontrolled growth of cells is required the formation of the new blood vessels and the lymphatic vessels in the cells. So, with that, so the cancer cell will form a new blood vessels and the lymphatic vessels with the pre-existing vessels to get more amount of the nutrients and the oxygens for the survival as well as for the invasion and for the further growth of the cancer cells. So, there is a new formation of blood vessels and lymphatic vessels are required for the growth of the cancer cells. Now, there are when any cell convert from normal to cancer cells by internal changes. So, when you observe normal cells and the cancer cells, we will see few changes in the cells. So, that will help us to target the tumor cells. In that we are going to see few tumor microenvironments. So, in the first one is that the hypoxia is one of the feature we will see in the tumor microenvironment. Now, as we know, cells will grow rapidly, nothing but the cells will rapidly proliferate, often outpacing their blood supply, as we discussed in previous sentence. So, definitely they need high amount of the blood, but they are growing very rapidly, that leads to the less amount of blood will reach to that the cancer cells. So, that leads to the insufficient oxygen availability within the tumor tissues. So, that condition is called as hypoxia. So, lack of oxygen in the tumor cells because of the abnormal growth of the cells, which is called as hypoxia. So, the first condition is hypoxia, and second condition is the low acidic pH. So, which is comes because of the high proliferation. So, the cell will grow very fastly and other metabolic pathways will will undergo very fastly, that leads to the lactate production because of the glycolysis. So, this lactate will accumulate in the cancer cells. Here we are going to see the second point, that is the low pH in the cancer cell, nothing but the acidic environment of the tumor cells, which comes with the high proliferation metabolism. As we know the mechanism, the glycolysis will go very fastly, that leads to the lactate accumulation in the cancer cell. This leads to the acidic pH in the cancer cell. And the third condition is, there are the enzymes which will overexpress in any type of the diseases. Similarly, in cancer also, the matrix metalloproteinase will overexpress because of the various hormones and the cytokines. So, all these three will help us for the targeting of the tumor cells. So, here you can see the picture representation. So far, we have discussed on the hypoxia and the low pH and the enzymes. In next slides, upcoming slide, we are going to discuss on the glutathione expression, increased reactive oxidation stress, then angiogenesis. So, this picture will help how the various feature will involve in the tumor microenvironment. So, the another feature is that high glutathione expression is one of the major feature in the cancer cell, that is upregulated in most of the cancer cells, because that is very important for the defense against the oxidative stress, otherwise cell will die. To overcome that oxidative stress, your cancer cell should produce glutathione that will reduces the oxidative stress by reduction mechanism. So, this is very important for growing of the new cells. So, that leads to the tumor growth and then survival. And the fourth point is increased reactive oxidation stress, that high oxidation stress which results from the oncogene activation and the anti-oncogene inactivation, and then aberrant metabolism which leads to the increased reactive oxidation stress in the tumor microenvironment. And the sixth one, the angiogenesis. Tumors stimulate the growth of the new blood vessels to supply themselves with the oxygen and the nutrients, supporting their rapid expansion and progression. Now, here there are the various pathways will help to form a new blood vessels, which is called as angiogenesis. There is a one molecule that is called as vesicular endothelial growth factor will stimulated by various mechanisms that leads to the formation of the new blood vessels, which is called as angiogenesis. So, these are the various features will help for the targeting of the tumor either by the passive mechanism or by the active mechanism or by the stimuli responsive mechanisms. So, these are the features are very important for the targeting. So, scientists have developed various delivery systems based on that features of the tumor microenvironment. Now, here we are going to see one aspect of the new blood formation. As I mentioned, the hypoxia, lack of oxygen at the site of the cancer cells. So, that pathway will upregulate new blood vessels. So, that will help to control the that vascular endothelial growth factor will help for the new blood vessels that leads to the angiogenesis. So, the cell can get more amount of the blood and more amount of the oxygen and more amount of the nutrients for the growth. So, this is very critical driver for the angiogenesis. So, whenever you want to target, so you can control, by controlling this you can control the tumor growth also. So, VGF targeting also one of the major strategy in the cancer therapy. So, tumors are capable of massive production of the molecular factors which are overexpression of G protein coupled receptors, other growth factors, interleukins, proteases of different classes will see the production in the cancer cells when compared to the normal cells. And these overexpressed molecular factors will help cancer cells for the growth and the survival and the invasion. Now, scientists have developed, they have utilized this strategy as a targeting approach by using the various functionalities to target the cancer cells. Now, here you can see the healthy cells. You can see there is the formation of the blood vessels which is in a controlled manner, and you will see the blood supply. There is no disturbance in the normal cells, right. Whereas, you can see the endothelial cells, their structure is proper, there is no change, there is no damage in their cells. Whereas, tumor cells, now we will see there is a disturbance in the blood flow, there is a damage in the blood vessels, and if you see these endothelial cells which are disturbed. So, with this function people have utilized and they converted drug delivery systems as an active and passive targeting systems to reach the cancer cells. Now, here we are going to discuss on the tumor targeted drug delivery. So, with the tumor microenvironment we can utilize and you can convert our formulations, our drug delivery system into the tumor targeting formulations by using the intrinsic properties of the tumor microenvironment. So, now here we will see the presence of characteristic molecules on the tumor cell surface and in the tumor microenvironment can serve as a specific label to targeted drugs functionalized with the specific target moiety, leading to increased drug accumulation in the tumor. So, whatever we have studied so far with the tumor microenvironment, we can utilize that, and it may be the overexpression of the cell receptor and the tumor microenvironment, we can increase the accumulation of the drug compared with the normal cells. Definitely your targeted system will not reach to the your normal cell. So, tumor blood vessels are structurally, functionally different from normal vasculature, and this difference are key designed to targeted drug delivery. Now, we can see here these are the normal vessels, these are the tumor blood vessels. So, now you can see there is a damage in the blood vessels, there is a gap. So, with that your nanocarriers go and retain in the cancer cells. Now, you can see the stable blood flow, unstable blood flow, and you can see there is a disturbance in the tissues, and these disorganized connections, hypoxia. So, that are the conditions of the tumor microenvironment. By utilizing this, we can target our formulations for the cancer therapy. So, this we already discussed in our first lecture. So, the levels of targeting, there we have discussed based on the order, based on the target site, we can utilize it for the treatment. So, in here for the tumor, we are going to see specifically for the tumor. So, the levels of targeting can be classified into 4. One is first order or organ based targeting. So, we can, by using this approach, you can target various cancers, either it may be liver cancer, brain cancer, pancreatic cancer, breast cancer. This type of approach is called as organ based targeting. And the second approach is the cellular targeting, nothing but secondary organ. We will not focus on the tissues, on the organs. We will focus, we will target to the various types of the cells. Example is hepatocytes and the endocrine cells. So, these are called as cellular targeting, and we can go into further into deep of the cells. We are going to target on the organelles of the cancer cells by targeting nucleus and the mitochondria, which is called as a tertiary ordered targeting. And the final one, we can go into deeper, we can stop the synthesis of DNA in the cancer cells and the protein synthesis also by using the macromolecular or fourth order targeting. So, these are the various targeting approaches by using level of targeting. Yes, these are also we have discussed in our first lecture, that is passive targeting is associated with a specific feature of the tumor vasculature, as we discussed in other presentations also by using of the EPR effect and the pH sensitive and other nanocarrier systems, we can follow passive targeting. So, here in example also we can see the structure of the cancer cells which is damaged. So, here easy penetration and the accumulation of formulation is possible in the tumor cells, which is called as enhanced permeability and the retention effect. So, which described by Matsumura and Maeda. So, these two scientists, so Matsumura and the Maeda, they have discovered the EPR effect which work in the cancer cells. So, the nanosystems will specifically retain in the lymphatic leakage systems as well as which will retain for the longer time compared with the normal cells. So, that is called as EPR effect. So, the second one is based on the active targeting will help based on the overexpression of the receptors. So, by targeting of the overexpressed receptor on the cancer cells, we can enhance, we can target the tumors. And the third one is the cell mediate targeting systems that we already discussed in our previous slides. And we also discussed the stimuli responsive systems, which are nothing but by using endogenous and the exogenous systems, we can also target the tumor cells. These are already discussed in our previous lectures. So, with these 4 types of targeting, we can do the treatment for the cancer cells. Now, here the third topic is ligands for targeted drug delivery. As we discussed in our previous slides, definitely some of the receptors will overexpress in the cancer cells. So, here these are the receptors will express in various cancers. So, for example, folate receptor, herceptin receptor, transferrin, integrin, CD44, EGFR receptor, and then prostate specific membrane antigen. So, this all will overexpress in various types of the cancers. So, here there are the examples for folate receptor. So, if you want to target any type of this cancer, ovarian cancer, lung cancer and breast cancer, you must label your drug or any type of active molecule or your carrier by using the folic acid. So, your folic acid, consider this is your carrier system and this is your receptor, and here is the cancer cell, and this is overexpressed folate receptor. Now, if you want to target your molecule, your carrier system, that must be labeled with the folic acid. So, then it specifically go and bind with that receptor. So, that leads to the internalization of your molecule. So, here we need to use functional ligands which will go and specifically bind to the overexpressed malignant cancer cells. So, these are the various types of the functional ligands. You can use it for the targeting of various cancers by stimulating the receptors. So, here also the pictorial representations of the various types of the ligands used for the targeted delivery. So, here these are some of the biopharmaceutical characteristics, so which are very important for targeted delivery systems, in especially for the cancer. So, your particle size should be 10 to 200 nanometer, definitely that will follow for the EPR effect that allows for the high accumulation of the nanocarrier system in the tumor vessels, that will also avoid the rapid clearance compared with the plain drug or non-carrier based systems. Surface charge also very important, that should be neutral, slightly negative, even positive also preferable for the interacting with the cell membranes. Yes, the neutral and slightly negative hydrophilic coating will help for the rapid opsonization. So, if the opsonization follows, your nanocarriers will clear from the blood. To avoid the opsonization, your carrier should be slightly negative and the neutral charges. Biodegradability is very important, because your polymer should be degradable, that should be cleared through excretion process after the drug release. Now, the fourth one is stealth properties. This already we have discussed in the various types of the liposomes. So, pegylation will help for the improved blood circulation by avoiding the RES system, reticuloendothelial system. So, with this you can expect the long half life compared with the non-pegylated systems. So, this will work as a surfacing coatings. And ligand density, yes, we have discussed, we can also target by the active targeting approach. So, yes, it will definitely affect the binding efficiency and the receptor saturation. So, that is very important. So, too little or too much can reduce the efficacy. So, for ligand density, so binding efficiency is important, and the receptor saturation also we need to consider. Optimized ligand should be presented on your carrier system. So, that will improve the efficacy or efficiency of your formulation. Drug release kinetics also very important. So, when you use the stimuli response or pH dependent, that will go and release at that particular site based on the different polymers. The polymer will affect the drug release parameters. Internalization efficiency, yes, by you targeting with the receptor mediated endocytosis system, your carrier will must promote this system for the intracellular delivery. So, this is the one case study. Here we are going to discuss the active targeted drug delivery system. As I mentioned, various types of cells will overexpress on various types of the cancer cells. In case of breast cancer, in liver cancer and other types of pancreatic cancer, the receptors will express and that will depend on type of the cancer. For example, here we are going to discuss on the breast cancer. As we know, the folate receptors will overexpress in the cancer cells. Now, here also you can see in the picture. So, to target this folate receptor in breast cancer cells, your carrier should be grafted or it should be conjugated, it should be functionalized with the folic acid molecule, because the folic acid will specifically bind with the folate receptors which are expressed on the overexpressed on the cancer cell. Now, this study will speaks about the folic acid grafted chitosan alginate nanocapsules loaded with the turmeric oil. So, as the scientists work here, here you can see the reference also. So, if they want to prove that the turmeric oil, when you conjugate, they will show high efficiency compared with the conventional or free turmeric oil. So, the scientists have developed folic acid grafted chitosan alginate nanocapsules. Within that, they have loaded with the turmeric oil and then they have seen the efficiency. Now, they compared with the two types of systems. So, one is unencapsulated turmeric oil and the second one is the targeted turmeric oil. So, they have developed two different systems. One is with the targeted approach and another one is the only conventional system, that is a turmeric unencapsulated turmeric oil. Now, they compared the anti-cancer activity on the two different types of the breast cancer cells. Now, they compared with these two types of the cells. So, here you can see the concentration. The red color indicates the unencapsulated the turmeric oil and the blue represents is the targeted one. Now, here you can see MDA MB231 breast cancer cells. So, responding very highly with the targeted turmeric oil. Similar type of effect we will see in case of MCF cell lines. So, cell viability is decreasing, whereas unencapsulated you can see here up to 50% and here also the 60%. So, there is no much effect, whereas the IC50 value for the targeted oil is very less. So, that is very important for the targeting. So, not only that, they have given the various IC50 values, they have compared. Here this is a unencapsulated and this is the encapsulated with the targeting. Now, you can see the IC50 value is very less. So, that speaks about the efficiency or the importance of the active targeting. So, with this we will definitely will understand that in various types of the cancer cells, the active targeting will be effective compared with the non-specific targeted drug delivery systems. So, with this case study, we are going to stop today's lecture. In our upcoming classes, we are going to see on various types of the targeted drug delivery systems. We are going to see in next class on the brain targeted drug delivery systems. Thank you so much.